I was nervous for surgery, yes, but actually it wasn't as bad as I thought it was going to be.
I felt very safe. I felt I was being looked after. I thought my worries, if I had anything, anyone would respond to me quickly.
I think, you don't want to worry too much about it. You'll be fine. Whoever is having it next, you'll be fine.
You will wait in a single-sex room on a ward. All patients need to arrive in the hospital before the beginning of the operating list so that there is time for you to see your surgeon, anaesthetist and nursing staff. This does mean that some patients need to wait several hours for their operation, so please bring a book or magazines to help pass the time. If your operation is later in the day, you may be advised that you can drink water for a set period of time to make you more comfortable. But please do not drink anything unless you are instructed to do so. It is important that you stay as warm as possible while you wait for your operation. We have found that patients easily get cold without realising it while waiting for their operation, and this contributes to a slower recovery. So we really would recommend you bring a warm dressing gown with you, and if you feel cold, please ask for a blanket. When it is time for your operation, you will be taken down to theatre by one of the theatre team or ward staff. Most people walk down to theatre, but if you can't walk far, a wheelchair may be used. You will be taken to wait in a lounge in the theatre suite for a short period of time while the theatre team complete the preparations for your operation. If you need to wear glasses, hearing aids, or wear a wig or hat due to hair loss as part of your treatment, then please feel free to continue wearing them when you come down to theatre. In the next part of the video, we will show you the anaesthetic room and the operating theatre and explain a little bit about what happens in there. We were advised by patients in the making of this video, and based on their comments, we have made sure we don't show anything that we think will make people squeamish. We have not included any filming of an actual operation. You will be shown to the anaesthetic room. This is a room next to the operating theatre. Here you will meet the anaesthetic team. At this point, you will remove your dressing gown and slippers, which will be placed in a bag, which will return to the ward with you. Wigs and hats can remain on for the duration of the operation. Glasses, hearing aids or false teeth will be kept safely and will return with you to the ward after your operation. A series of safety checks will be performed, which will include asking you your name, date of birth, and if you have any allergies. Staff will check your wristband. They will also check the consent form you have previously signed and that the site for your surgery has been marked with a marker pen. The anaesthetic team will attach you to monitoring equipment, which allows them to closely monitor your well-being during your operation. They will place stickers on your chest and connect these to a machine that will allow us to monitor your heart rate and rhythm. We will also place a blood pressure cuff on your arm to allow your blood pressure to be monitored every few minutes during the procedure. You will be asked to place your finger into a probe. This will allow us to monitor the oxygen levels in your blood continuously. Your anaesthetist will need to give you drugs into a vein. They will do this through a small plastic tube placed in a vein in your hand or arm. This is called a cannula. It will be secured with an adhesive dressing. Flotrons will be placed on your legs. These are connected to a machine which squeezes or massages your calves during the operation and during the period of time straight after your operation to reduce the risk of clots developing in your legs. A soft mask will be placed over your nose and mouth. This will be used to provide pure oxygen for you to breathe before the anaesthetic. The anaesthetic is usually started by giving a drug into your cannula. Once you are completely asleep, a tube will be placed in your airway which will allow oxygen and gases to move in and out of your lungs easily. This will remain in place until you wake up from the anaesthetic.